Good evening. It is my pleasure to introduce to you Ms. Christina Reed, a sickle cell disease advocate. Christina attended Virginia Commonwealth University. She is the mother of two amazing daughters who live with sickle cell disease. She lives in Virginia Beach with her husband and six children. Olivia, Taylor, Morgan, Skylar, Hudson, and Harper. She is the founder and executive director of Virginia Sickle Cell Network and a community health advocate. Christina is an advisory board member to many organizations such as the Children's Hospital of King's Daughters, Fulcrum Therapeutics, Red Cross Sickle Cell Task Force, and Fortified Health Sickle Cell Work Group. She became a community health worker through Sickle Cell Disease Associations of America and founded Virginia Sickle Cell Network. One quote that is very dear to Christina is that of Dr. Martin Luther King Jr. Of all the forms of inequality, injustice in health is the most shocking and inhumane. Without further ado, I present to you Christina Reed.
Thank you for that introduction, Ms. Kane. I am so excited to be here to be able to talk about one of my favorite topics, not because I love sickle cell disease, but because it is very important to me to share as much information, as much awareness, as much education, and my passion for the topic and because of the people I know who I love. I'm right now wearing a button that says, "Ask me about sickle cell disease." And I wear it all the time in order to spread awareness to everyone and anyone who will listen. So I'd like to thank the Suffolk alumni of the chapter of Delta Sigma Theta. I'd like to also thank President for allowing me to have the opportunity to speak today. If we can start the slides up, we can get started. Thank you. So today, I am speaking about sickle cell disease and its trait, with the focus of understanding the condition and its impact on the Black community. Next slide, please. This is me, my husband, and our big family. I am the proud mom. My husband and I are proud parents of 6 children, 2 of which are living with sickle cell disease. Dr. Roach just spoke a little bit about the types of sickle cell disease, and Morgan and Olivia were both diagnosed with sickle cell disease, hemoglobin SC, at birth. So one of my goals in life, our goals in life, is to see a comprehensive world of everyone whom you encounter who are educated and compassionate about care, about sickle cell care and concern for sickle cell disease and the people who are impacted by sickle cell. You can go on to the next slide. These are my girls, Olivia and Morgan, and I have a little quote underneath that says, "But you don't look sick." As we were watching the original PSA, Believe It, at the beginning of the webinar, I get so emotional when I watch that because in their short time on Earth, their short lives, that has been some of the conversation that's been said. Well, but they don't look sick, in a negative and in a just an uninformed way, because even if they're happy and healthy and walking and talking regularly, there's sickling going on inside the body at all times. So one of the reasons why I do what I do is in their journey, we've recognized gaps in care, not just for them, but for all of the people like Ms. Charmaine Brown who are living and impacted by sickle cell disease. And they have had experiences that has not been the best experience for somebody who has this disorder to have an optimal health and not have additional stigmas, additional inequities that prevent them from living well with sickle cell. So we started Virginia Sickle Cell Network to address some of these gaps in care and to create a sustainable network of resource partners, caregivers, community members, healthcare providers, educators at the schools, everybody, to just kind of get them to work together to enhance the lives of individuals and their families affected by sickle cell. And we do this through, advocacy, awareness, education, and support. Next slide, please. So we've talked a lot about sickle cell disease, and actually Dr. Roach just defined it very well. Sickle cell disease is a genetic blood disorder that affects hemoglobin, leading to the distortion of the red blood cell, causing pain, anemia, and other complications. Next slide, please. But as some of our network members can tell you, sickle cell disease is invisible and it is more than just pain. These are some pictures of some of our community members who we have connected with, and we just have a great network to support one another and encourage one another and advocate for one another and all of that good stuff. So it's just something that we want to express is sickle cell is more than pain. It's more than pain, and it's invisible. Next slide, please. Again, this is just going to be a recap from our previous presenter. The challenges of sickle cell disease: pain, which is described as the vascular occlusions in the bone marrow, the bed of the bone marrow, leading to, and some of the complications are bone death and muscle damage. Then we also have organ damage. In 2016, when we first came here to our local hospital, the doctor who was there, who is not there anymore, he had a conversation with my girls. This was not their home hospital was in Georgia at the time, but he had a conversation and he said, sickle cell affects every part of your body from head to toe. And we're seeing and learning as the kids have grown, we see and learn more and more of the damage that that sickle cell disease can cause. One other complication of sickle cell is mental health complications. When you're concerned about your health, you're concerned about your fear of going into crisis and all the other life issues that happen that can complicate your mental health. And then, of course, we just had a humongous pandemic, and the immunocompromise that exists with sickle cell disease that affects, right now, my girls are actually going through colds or experiencing something. We don't know quite yet what it is, but we'll find out soon enough if it's anything that causes them to have to be hospitalized, or as my younger of the two girls with sickle cell has had spleen issues, just from your common colds. So sickle cell disease is compromises your immune system. Next slide, please. So let's talk about sickle cell disease and its trait in the state of Virginia. Each year, about 75 newborns are identified with sickle cell disease. I think Mrs. Charmaine Brown talked about the testing, newborn screening that is done in Virginia. And at the time of her birth, they had not begun testing regularly for every newborn until 1989. So we have 75 born each year. In the state of Virginia, 1 in every 325 African Americans currently live with the disease. I'll go further to talk a little bit about our Hampton Roads area. Hampton Roads, Tidewater, Virginia area has the highest population of people living with sickle cell disease. In total, there's 582 in the state of Virginia living with sickle cell disease. I should note that that's estimated. Further, we'll go to sickle cell trait. 1 in every 12 African Americans in Virginia are living with the trait. Next slide, please. So we'll talk about what is going on with sickle cell disease in our area. Dr. Wally Smith, a doctor in Virginia, Richmond, Virginia, Virginia Commonwealth University Health System, he quotes, most of the patients with sickle cell disease live in the Tidewater region. There's no clinic with even 100 patients in Tidewater region for adults. And now adults are outnumbering the children. And one of the unfortunate things that is going on is that some of our adult warriors, sickle cell disease warriors, are traveling from the Hampton Roads area 2 hours to Richmond, Virginia to receive care, even in crisis, or that is their specialist, their hematologist is located in Richmond. Fortunately, Centera is working toward making some changes with that. Next slide, please. In our organization, our goal is to try to alleviate and eliminate some of the stigmas that are associated with sickle cell disease that are prohibiting compassionate care in order to provide the best health outcomes for sickle cell disease warriors. So some of the stigmas associated with sickle cell are, next slide, please. Drug seekers. The 2 presenters before me mentioned this very topic. And what happens is the challenge with pain management is the only option is an opioid drug. Because a lot of our sickle cell patients, especially in this area, are not seen regularly by their specialists, their hematologists, or even oncologists to care for their sickle cell disease. We are going into the emergency rooms and unfortunately being labeled drug seekers. And the truth is, out of the 70% of sickle cell patients are not even wanting to go to the hospital, not even wanting to go to the emergency room to be cared for when they're in crisis because of the stigma. I noted that we were watching, Netflix had a show, Lenox Hill, and there was a young man who went to be seen, and this was a emergency room in New York, and he was a sickle cell patient, and the provider was almost dismissive. He fell a few days before, and he was in the hospital before and was coming back because he was again in pain. And when she was talking to the camera, she made mention that sometimes they come back because they want some more drugs. And it hurt my feelings because the only time she thought of him as a human being was when he said he was only home in New York because he was on a break from college. It was maybe Christmas break or something like that. Then the lights went off in her head that, hey, this person's doing something with himself. Maybe I'll treat him like maybe I'll treat him like somebody I should respect. So we want to address more and more about eradicating the stigma of sickle cell warriors being drug seekers. Next page, please. We call it, instead of drug seekers, we'd like to use the term receiving pain relief. We'd like to look at it as your patient is coming in because they're in severe pain. Like we said in the previous slide, 70% of adult patients are not wanting to go into the emergency room because it's too much of a hassle to go in. So just thinking about it in a way of, hey, these are people who are in severe pain or have whatever additional complication that sickle cell is having the patient present in, let's look at them as someone who is seeking relief from this pain. A statistic that I have from the opioid epidemic, is that an estimated 10% of patients with sickle cell are addicted to opioids. So that is a very small number compared to the entire epidemic that is going on that prevents some providers from prescribing pain relief for their patients with sickle cell. Next slide, please. More stigmas that we want to talk about, dispelling common misconceptions. Let's see, the next slide, please. Oh, I think I'm missing a slide. Sorry. So one of them is sickle cell patients or people with sickle cell are lazy. They're lazy, drug seeking. So I have one person, her name is Bethany. She's a Virginian-born model, nurse, sickle cell warrior, and patient advocate. The list goes on and on and on. Mrs. Charmaine Brown is not only was she told she was not going to live in her teen years, she's received her master's degree and working in human resources. The list goes on and on. If you'll allow me to brag for a second, my daughters are doing extremely well. I have one daughter who dances 4 nights a week, volunteers for everything in honors classes, and is doing very, very well. And while my oldest daughter is a senior, and she just got accepted into her dream school on a full ride scholarship. So I think the thought is, instead of creating a misconception because people with sickle cell have challenges, as Dr. Roach discussed, there are some people who have sickle cell with developmental delays, or some people who may have physical challenges that prevent them from working. Let's start looking at people and thinking about how they are able to overcome their challenges. Thank you. Next slide, please. So we want to talk about fostering understanding and empathy. Please, let's go to the next slide. So some of the triggers that present with people who have sickle cell disease that can present some of the triggers that can cause complications with sickle cell are heat and dehydration, physical activity, the individual themselves, or maybe even their genotype. Some people with sickle cell SC may have more issues with their eyes or with their hips, or than somebody with beta thal or another genotype. So another trigger could be emotional stress, and of course, change in temperatures. Next slide, please. One of the big issues that I encounter as an executive director of VSCN is housing, hunger, and income insecurity. When you yourself are a patient and you have no idea when you're going to be in crisis or, needing a blood transfusion or have to be hospitalized, your job security is not at all in existence. One of the main needs that we have had over the last 2 years has been housing. And I think housing and the income go hand in hand, because some parents are unable to work. Parents are unable to attend their jobs regularly, because they don't know when their children or their loved ones are going to be sick and need to be hospitalized. So this emotional stress can impact the overall health of someone with sickle cell disease. I also want to touch on hunger. We did a needs assessment a few years back, And more than half of those we surveyed had some need for food or medication because they may not qualify for SNAP benefits, or they do not qualify for Medicaid, but there's still a gap for providing or being able to pay for these services that is not met regularly. So we have partnered with Unite Us to kind of try to get some of these resources provided for, or at least referred to those organizations that are able to provide these services for our network members. Next slide, please. So we talked a little bit about mental health and sickle cell disease. There is some intersection between physical and your mental well-being. If we think about the nature of the disease, the fear of possibly being sick or worse, especially with all the access that we have in media, where we get a lot of information fast, and sometimes it is more damaging to get this information about warriors who have passed on, or warriors who are not getting great care, and how that affects and impacts the mental health. What we do, and what we continue to do at Virginia Sickle Cell Network, is we have a support group, and we provide maybe mental health services 1 month, or someone who is a provider, we'll have them come and talk with us, or our caregivers connect with one another, and we just kind of provide that support for one another. Next slide, please. So let's talk about the importance of community. I've mentioned it a couple of times before, but there is a connection between having a good support system and having better health outcomes. Next slide, please. So the role of community supporting individuals with sickle cell disease, that's some of our community members like you, who may not have sickle cell disease, or may not have a family member who has sickle cell disease. You have an important role in caring for, or being a part of this network, and caring for and supporting those who are living with sickle cell disease. One way we can do that is by increased awareness, learning more and more that we can about sickle cell disease, and sharing that information in your jobs, or with policymakers, advocating in ways that are beneficial for those living with sickle cell disease. And once we're doing that, if we're working together as a community, it improves the quality of life. And again, I spoke a little bit about advocating for better healthcare providers, or healthcare policy, in addition to the policymakers and the funding for research, and also funding for the small organizations that are on the ground and working directly with the community who are directly impacted by sickle cell disease. Next slide, please. So again, our mission is to enhance the lives of individuals and families of those affected by sickle cell through advocacy, awareness, education, and support. This is a group of some of the moms of children who have sickle cell disease at our annual awareness and advocacy forum that we have. Next slide, please. This is a program of Virginia Sickle Cell Network. These are my girls, Olivia and Morgan, and their program is Two Terra Girls Care. So what they do is advocate, they're young advocates and allies for people living with sickle cell disease. They do most of their work online on Instagram, but when we do monthly support groups, they will facilitate a breakout room for their peers, do fundraising, and another thing that they're personally are excited about doing is providing gift cards for parents whose children have been hospitalized. So the parents or the caregiver, even adults, they're when they're there with their loved one who's hospitalized, it is difficult, especially if you are not able to provide food for yourself. Your kids, your child, or your loved one, they're getting food as a part of their hospital stay. So sometimes the hospital will give a 30% discount in the cafeteria, but the girls like to provide gift cards for those who can't pay for the 70% that they would be responsible for. So next slide, please. So one of our goals is we like to address the needs. Yeah, I kind of spoke about this, but we address the needs through programming and in other ways. Next slide, please. And again, if you are a healthcare provider, if you have sickle cell disease, if you're a caregiver of someone with sickle cell, if you're an educator, a human resources provider, human service agency, if you are breathing, we would like you to join our network to work together to support some amazing people whom we love dearly. Next slide, please. This is more talking about people, some of the people who are in the network. Next slide, please. Our goal is to promote whole person health for individuals and families living with sickle cell disease. Next slide. Also, we like to promote or facilitate access to quality care for the underinsured or non-established or displaced individuals. Unfortunately, in the Hampton Roads area, adult care is limited, and most people with sickle cell are going to Virginia Oncology. They go there to seek care, and yeah, I think we have a while to go, but fortunately, Centerra's on board, and we're trying to get where we need to be for our sickle cell adult community. Next slide. So again, we hope to cultivate a new world for people with sickle cell who provide compassionate care management. Next slide. How can you help to shape compassionate futures? Hey, how about you continuously spread awareness, give blood, know your genotype, know if you are a trait carrier or not. The website scdaa.org, they can let you know about different testing locations, as well as the Red Cross. I know that if you give blood, which is another way that you can help, if you give blood now as a Black person in the United States of America, your blood is directly banked for someone with sickle cell disease. And in addition to that, they will do the testing to let you know if you have sickle cell traits or not. Also, donate your time, your resources to our organization or another organization who could use any of your expertise in order to effectively facilitate our missions. Next slide, please. Or you can make a donation, and here is a QR code for our PayPal. Next slide. Thank you so much for having me. My email address and contact information is here. Also, the way for you to find us on Facebook and Instagram is at Virginia Sickle Cell Network. Thank you so much for having me.
Greetings. Thank you all for these informative presentations on sickle cell disease and the importance of genetic counseling and testing. My name is Dr. Regina McKinney, and I am the Physical and Mental Health Committee Chair for the Suffolk Alumni Chapter of Delta Sigma Theta Sorority Incorporated. We are now open for questions for the presenters. Please feel free to leave questions in the live chats on YouTube and Facebook. We have a few questions on Facebook, and let's see if we can get through some of them. I would like for all of our speakers to come back, if we can pin them as well. Okay, one of the first question on Facebook we had, people who have the sickle cell trait, do they have the same symptoms as a person who have sickle cell anemia? Mrs. Reed, would you like to answer that?
I think one thing is important to realize is there are different variants of trait as well. So there's the S trait that is the one that you more than likely hear that you have when you know that you have trait. I have C hemoglobin, which is an abnormality to the hemoglobin, but paired with someone with the S trait, that is SC disease. So knowing if you have trait is important. Secondly, I believe that there are some detrimental events that happen when you have trait. In example, when you hear about football players who are practicing outside in pretty hot conditions, or if they're flying over to, let's say, Denver, for example, that's when you probably will have more symptoms of trait. However, I don't think that it is, I don't know that the symptoms are the same. However, I'm sure that you can have symptoms or complications with trait that is something that I believe Dr. Roach said to speak with your primary care provider. I know at one time the NIH was doing a study when my first daughter was diagnosed, and I was reaching out desperate trying to find somebody who could tell me, what am I going to expect with this baby? And that's one of the reasons why BSCN is in existence today, is for community. One lady was telling me about the study that was going on in the NIH for people who have trait. So that's the best way that I can answer that question.
Okay, thank you. This question is for you, Mrs. Brown. What advice would you offer young adults with sickle cell disease on advocating for themselves in the emergency room?
Thank you for that question. That is a great question. As a young adult, to advocate for yourself, one thing I would say, know your medical history as much as you can. One thing for me, when I go to the emergency room, they ask me what works for you, what doesn't work for you, what can I give you, what can't I give you. So know your medical history, know what works for you and know what doesn't work for you. Another thing that you could do is, if you have a close family member, your spouse, your adult children, if you have any, let them also know your medical history and let them know what works for you as well. Being a sickle cell patient, being a sickle cell warrior, going to the hospital, talking to the doctors and the nurses, you really have to advocate for yourself. I mean, I think one of the most difficult things is going into the hospital and things happen all the time. And sometimes it's hard for us to speak up. Sometimes people with sickle cell are afraid to speak up because of the different stigmas that's attached to sickle cell. But we have to overcome that and just be there for ourselves, be there for our loved one, to speak up when we need to. I mean, advocacy is the key. So we got to kind of get over that and talk to the doctors and talk to the nurse and let them know what works for us.
Excellent. Thank you for that. We had a question about whether or not sickle cell testing was still required to get a marriage license.
No.
Oh, everybody. Okay. Okay, yeah, that was one question. And then we had a question on whether or not there will be a cure for sickle cell disease. I had a question that I wanted to pose to Dr. Roach regarding the Federal Drug Administration approved the sickle cell gene editing tool from CRISPR called Gasgavi therapy. Do you think these gene editing tools will be a game changer for sickle cell patients? And the second part of that question is related to, will the gene editing tool be accessible for families?
Okay. That was a loaded question. Thank you for that question, though. So first, the first part of that question is the known cure, what we identify and speak of now as having a cure for sickle cell, is a stem cell or the bone marrow transplant. This is the only cure. As far as the gene therapy, maybe in the near future, it might be considered a cure. Yes, it is a game changer, but not everyone can tolerate the preparation that the body needs to go through in order to have that. And the same for the stem cell transplant. And in terms of finances to make it accessible, there are groups now, including SCADA and other local organizations, where we're trying to affect policy to make sure that the drug companies provide ways that it can be affordable for families. That was one of the statements. I'm a board member of the International Association for Sickle Cell Disease Nurses and Professional Associates, also called ISCNAPA. We put out a statement before when we knew that the FDA was going to approve it, but it was before it was announced. And those were some of the questions that we asked them to make sure they continue to address with respect to making sure it was affordable, that it was accessible to the families. So all those people that did the research and got those research dollars, now that we know that it's going to impact, potentially positively impact these families, let's make sure they can access it. So that's my response. Thank you for that question.
Oh, yeah, excellent. When I read about it, and it costs like $2.2 million, and some of it partially covered by insurance companies. So it was definitely, I just wonder if it would be a game changer for the sickle cell patients. Then we have a couple questions on Facebook. One question is for Mrs. Brown. Do you have certain things you do for pain management and or proactive care?
I do. When I feel a crisis come on, even before I go and take the medication, I try to get heating pads. I have heating pads, heating blankets. I, take hot baths. Try to subside the pain before I go to take the medication, because even the medication at home is very strong medication. And Christina, you can agree with your girls. So I try to avoid that. But if it gets to the point, I do everything with the hot baths and the heating pads and the electric blankets and everything. I take the narcotics, the medication that they have here for me. And then if it gets to a certain point where we can't manage it at home, anything that we can't do at home, we go straight to the ER. Another thing that I do, if it's during working hours and I can get in to see my hematologist, which I'm very thankful for, they do have an infusion center. So I can medicate at home, go to the infusion center and get IV fluids. Something with sickle cell, if you feel yourself going to a crisis, if you hydrate properly in the beginning of the crisis, it can kind of subside the pain and avoid the crisis before it can get worse. So for me, trying to get ahead of the pain, as soon as I feel something going on, something just isn't right with me, I try to get ahead of it before it gets worse. Sometimes it doesn't happen that way, and we jump from 1 to 10 quickly, and we go straight to the emergency room. So preactive care is number one in our household. We try to get ahead of the game as much as possible.
Excellent. We have a question from a registered nurse in the Tidewater community. I often care for patients with sickle cell disease. I'm wondering, are there any non-pharmaceutical ways to comfort them in these crises? And actually, I think Mrs. Brown, you answered some of them,
Yeah.
but Dr. Waite? No, but yeah, you're muted, Dr. Roach.
Oh, I was asking if you could repeat the question. I only
Okay,
heard.
yes. The question, as a registered nurse in the Tidewater community, I often care for patients with sickle cell disease. I'm wondering, are there any non-pharmaceutical ways to comfort them in these crisis moments?
Well, as Charmaine just, Miss Brown, the way as she just described, one of the things is to try to reduce the amount of stress that you have in your life. If you're around toxic people, stress causes you to have vasoconstriction. And so that just exacerbates the possibility of having a crisis. Then also, the warm baths, the heating pads, um, other things that you can do for distraction before you get the medications. We have another study going on right now with acupuncture, believe it or not. And so we're having positive results and with that for the outcomes, but it's only a limited study. I think maybe there are like 250 individuals in that particular study, but they are seeing positive outcomes of that. So to answer your question, yes, there are other things, but it really depends on the person. It depends on your genotypes, as Christina alluded to, and in your environments. Like I've noticed if I'm recruiting for a study, and the temperature changes in either direction, if it's a drastic temperature change, I'll either call the patients and check on them and let them know it's okay to cancel because sometimes the stress of, oh my God, I have this scheduled and I have to make it, that adds to the whole problem that you're working to alleviate. So really temperature change, just, being aware of what's going on in your environment are some of the proactive things that you can do.
Okay, thank you. We have several other questions, but I'm going to take this one from Facebook. It has been read that there was a correlation between sickle cell patients and the amount of time they wait in the emergency room. Is that something that you have experienced?
That's definitely, and I'm going to let Charmaine speak to this from a personal perspective, but that's definitely an issue. We've had problems where patients didn't survive the waiting room.
Mm-hmm.
We have situations where people who have long bone injuries that are very, very painful have a shorter wait time than individuals with sickle cell disease. So yes, it's problematic, and it continues to be, which is why, part of the work that we do in the rural Delta area in the Mid-South is going to these areas and doing educational programs for them. Because a lot of times at the end of those programs or during the talks, even, they're like shocked. They're like, I didn't know that. So it's not always malicious, even though sometimes I think it might be. Maybe I shouldn't say that, but it's true. But other times it's not. It's just that people haven't been exposed. They're not taught about it in nursing schools. The university where I'm on faculty, I scream to the rafters that it needs to be intertwined into every course that we take or that the students take. It needs to be intertwined so they can show that that link. And the important part of that, me living in the Delta region, while sickle cell disease is most prevalent in 1 in every 375 individuals with sickle cell disease, or who have sickle cell, or African Americans living with sickle cell disease is 1 in 365 roughly. In the Delta region, it's 1 in 200. So it's a very dense area right here in the Mississippi, Arkansas, Tennessee, that corridor right there. So these nursing students are going to see these patients and they need to know how to care for them. But Charmaine, you can take it from here.
Yes, ma'am. I definitely agree with what you're saying. I remember an incident where I was going into a crisis and we, tried everything at home. And I had to go to the emergency room. My husband took me to the emergency room. We stayed in the emergency room before I got seen for about 5 hours. And the only thing that he could do in the emergency room was, try to keep me warm and, gave me, the medication that I had there, but it wasn't helping. We finally got back to see the doctor and the doctor just kept apologizing because it was kind of out of his hands until we got back to see him. But that is a big problem. And I love organizations such as what Ms. Reed has, because we need organizations and we need groups and we need people to advocate for us sometimes, even in those situations, so we can get the proper care that we need when we need it.
If it's okay, I would like to just add that a sickle cell disease crisis is as much of an emergency as a heart attack. There is organ damage in the same manner. So one of the things that we push and that we try to speak about when we're talking to some of our adult patients, because when you're in peds, like we are right now, when we go to the ED, we say sickle cell and we're seen within an hour. And that's how it should be. Within an hour, someone coming into the emergency room with sickle cell pain should be seen within an hour, given fluids and start the pain regimen. But unfortunately, it's not that way. So one of the things that we push is changing the verbiage and not waiting so long, because I think some of the thought process is, oh, they waited 8 days before coming in. So what's 5 hours? And it is a crisis indeed.
And one of the things that we push when we go to the Delta region to do the education for the physicians and nurses is we push to get them to understand that when these patients come into the emergency room, they need to be listed as a level 2, which is the same level as the individuals who are having cardiac disease or heart attacks. So we're pushing so hard for that, and may take a while, but for every talk that we give, we're a little bit closer.
Thank you all for that. We're going to conclude, but we have several other questions, and what we will probably do is we will send those questions out to you all and have you all answer, and then we can put it in our Facebook feed under the comments question. Mrs. Reed, I definitely would like for you to put in the chat, and someone can put it on Facebook, some of your partners for the Virginia Sickle Cell Network. So if you can, that was one of the questions that was that. So if you can put it in our chat here, and then we can have someone put that on Facebook for us. But thank you all for this. It was a wonderful opportunity for for the community. So this concludes our Black Health series on sickle cell anemia and trait. On behalf of the Suffolk Alumni Chapter of Delta Sigma Theta Sorority Incorporated, we want to thank our chapter and committee members. Thank you to the presenters, Dr. Powell Roach and Mrs. Reed, for sharing this great information on sickle cell disease. Mrs. Brown, we thank you for sharing your story on what it is like living with sickle cell. Thank you all for letting our viewers know how they can get involved in sickle cell research and the crucial role they play as blood donors. We would also like to thank our viewers for taking the time to join us and our committee members for participating in this series. If you have any questions for our presenters, please leave them on our website at suffolkdst.org, and we will forward them. Please take the time to complete the evaluation links in the chat. Now, we would like to inform you all of some of our chapter's upcoming events. First, we have a short video from the CDC on the Bridge Access Program.
Hi, everyone. Dr. Mandy Cohen from CDC. And the way you get your COVID vaccines has changed this year, but you can still get a free, updated COVID vaccine through the Bridge program. So a few questions. How do I get a free COVID vaccine? Great question. You can either get it for free through your health insurance, or if you're uninsured or your insurance doesn't fully cover it, the CDC's Bridge Access Program provides free COVID-19 vaccines at certain sites like CVS, Walgreens, health centers, and public health departments. Who can get a free COVID-19 vaccine through this program? Adults 18 years and older without health insurance, and adults with health insurance that does not fully cover the cost of their COVID-19 vaccine. This includes adults who may be at a pharmacy that is out of network for you. Remember, for kids, free COVID-19 vaccines are available for those eligible through the Vaccines for Children's program. Ask your child's pediatrician's office if they participate in the program. You can also get in touch with your state or local health department to find a provider who offers free vaccines to kids. Where can someone get a free COVID-19 vaccine? There are several ways to find a free COVID-19 vaccine near you. First, check with your healthcare provider or your local pharmacy to see if they're participating in the Bridge Access Program. At some pharmacies, you need an appointment to get your shot, but some locations take walk-ins for COVID vaccines. You can also search locations at vaccines.gov. That's vaccines.gov to find a provider that offers free COVID-19 vaccines. Search for the Bridge Access Program to find free vaccines near you.
Please join us for our 2024 Community Health Fair on Saturday, March the 9th from 10 a.m. to 2 p.m. at Kings Fork High School. Our health fair was fully funded by a community engagement grant from OBC Healthcare Foundation. You will be able to receive flu and COVID vaccines, private HIV testing, and blood pressure screenings. Parents, you do not want to miss all the children's activities and the free ice cream. We also want you to show your support of the sickle cell community by donating blood at our blood drive on Saturday, March the 30th from 10 a.m. to 2 p.m. at Greater First Baptist Church, Orlando. Please scan the QR code below or register on our website. We have one more session remaining for our UPS College Prep Series on financial aid on Saturday, March the 16th at 10 a.m. at Lakeland High School. This series is for students who have an IEP or 504 plan. Please come out. You do not want to miss our 6th annual Black History Extravaganza. It is happening this Saturday, February 17th from 12 to 1 p.m. on Facebook and YouTube Live.
Early voting for the 2024 presidential primary elections are currently underway. The last date to register to vote is Tuesday, February the 13th, and the last day to request ballot by mail is Friday, February 23rd. Saturday voting will take place on both February 4th and March the 2nd. If you wish to vote early, please visit your local registrar's office. All precincts will be open on Tuesday, March 5th for the presidential primary election. This is a reminder to get out to vote not only for this presidential primary election, but for the general election taking place on Tuesday, November the 5th. Delta Sigma Theta Sorority Incorporated is a 501c7 nonprofit organization. The sorority is nonpartisan and does not endorse candidates.
Follow us on our social media platforms, Facebook, Twitter, Instagram, and YouTube at SAC DST 1964. For more information on events and programs offered by the Suffolk Alumni Chapter of Delta Sigma Theta Sorority Incorporated, you can visit our website at suffolkdst.org. Be blessed, everyone, and see you next time.